www.healthcmi.com. Acupuncture continuing education online today. Acupuncture Allergy Relief confirmed. This was published November 9, 2020 at healthcmi.com. Simply click on news and take a look. Acupuncture and moxibustion are effective treatment modalities for allergic rhinitis relief. In a meta-analysis of 39 studies involving 3,433 allergic rhinitis patients, acupuncture improved nasal symptoms and rhinoconjunctivitis scores. Researchers determined that all types of acupuncture modalities are significantly superior to sham controls. Moreover, moxibustion was found effective within 6 treatments. Integrative medicine produced excellent outcomes. A combination of acupuncture plus conventional medicine significantly improved overall nasal symptom reductions, and a quality of life score within 9 acupuncture visits showed promising results. The combination of acupuncture plus conventional medicine was superior to using only conventional medicine. So they tested the hay fever, the allergies, the allergic rhinitis, which is an inflammatory disorder. Again, this is characterized by inflammation of the nasal mucosa caused by an allergen exposure, triggering an IgE-mediated inflammation response. It's in the United States alone, for example, 40 to 60 million people suffer from allergic rhinitis annually. Symptoms include thin and primarily clear nasal discharge, sneezing, nasal itching, and nasal congestion. It's also associated with decreased concentration and focus, irritability, sleep disturbances, and fatigue. Patients with allergic rhinitis have an increased risk of developing asthma. So they really listed some interesting stuff. They showed the acupuncture points, kind of standard out-of-the-box stuff. So Betang and Yin Shang, which is large intestine 20. Betang, the extra points, also known as Shan Yin Shang or EXHN8, plus Yin Tang, which they interestingly call Du 29, giving it the honor of being on the governing vessel, even though technically it's an extra point. They're calling it Du 29, which I find very interesting. Bladder 13 Fei Shu, Du 14. Dazoi was one of the main anti-inflammatory points in Chinese medicine and wellness points in Chinese medicine, plus large intestine 4 Hegu. That combination was used to look at these 3,433 patients. So again, those were the most commonly used points by acupuncturists across this entire study. Basically, all the studies, treatment ranged from 4 to 8 weeks of acupuncture sessions. And they basically said, look, it works for allergies. And hey, people need some relief. So think about it. People can use some kind of rescue remedy over the counter or prescription, right? But long term, we need to think about how to make year over year this process easier on people. I remember working with a doctor in a medical clinic years ago. And boy, I'll tell you, the first year I worked at that medical clinic, he was very nice. He welcomed me. It was great. But he would be out for a week to 2 weeks here and there, a few days here, a few days there with allergies. So I started giving him a little acupuncture, a little bit of herbs too. And a few treatments here or there. By next year, he had symptoms a little bit less. A few more treatments here and there. And every year I gave him a few treatments for about 2, 3, 4 years till finally he stopped getting his allergy attacks. But it was just a little bit less, little bit less, little bit less. He stopped needing meds and, he moved on. So again, after a bunch of treatments, he had already phased out the medication level and the symptoms were reducing. Eventually he stopped losing time off of work, things like that. So it can be a general process of enhancing someone's immune system. Now, guidelines from the American Academy of Otolaryngology state, quote, clinicians may offer acupuncture or refer to a clinician who can offer acupuncture for patients with allergic rhinitis who are interested in non-pharmacologic therapy. And the reference for that is at healthcmi.com. So if you click on news and look for the article Acupuncture Allergy Relief Confirmed, you'll see that reference from the American Academy of Otolaryngology, and you can see that they're literally signing off on acupuncture as a potential non-pharmacologic therapy. So people who are suffering from this are best to take a multidisciplinary approach. It's not enough just to take, let's say, an antihistamine or some other type of pharmacological agent to suppress it, when we really need to think about eliminating it from the root. Now, these findings, and this is in the article, are also consistent with UCLA, Morehouse School of Medicine, that's in Georgia, and Henry Ford Health Systems in Michigan, researchers that note, quote, there are high-quality randomized controlled trials that demonstrate efficacy and effectiveness for acupuncture in the treatment of both seasonal and perennial allergic rhinitis. Smaller head-to-head studies also show some preliminary benefit of acupuncture when compared with antihistamines, unquote. Pretty good. Now, in a related study, Beijing University of Traditional Chinese Medicine hospital researchers conducted a meta-analysis of 30 clinical trials, sample size 2,602 allergic rhinitis patients. And they conclude, quote, acupuncture used either alone or combined with other treatments such as moxibustion herbal medicine and Western medicine were proven to have both short and long-term clinical benefits to allergic rhinitis sufferers, unquote. Common points in that study, once again, interesting, large intestine 20, yin shang. That is literally translated as welcome fragrance. Yin tang, large intestine 4 hegu, stomach 36, Zhu San Li, and shang yin shang, which is bitang exhn 8. So not uncommon to see those points used. Again, this is not something that's a one-shot deal. It does take a little time to enhance someone's immune system to prevent this IgE response. So I think expectations have to be in line with what Chinese medicine can do. I think we're looking at the long game here. Now, short-term also can relieve suffering. If you're taking some kind of drug or medicine, or even if you're not, it's going to give you some relief. But what impresses me more is that in the long run, someone eventually won't need treatment for it, or it will be highly minimized because they're simply not having that reaction anymore. So that's what I'm much more interested in, is this long-term enhancement of the immune system. This study shows exactly that from multiple sources. So I invite you to take a look at that. I hope you enjoyed today's episode. I'm Adam White, licensed acupuncturist. Thank you for listening. www.healthcmi.com